Hi, I'm Dr. Jessica Simone, dermatologist here at Windsor Dermatology and also pediatric dermatologist. There's different types of acne. There's inflammatory acne where you get big red inflamed bumps or nodules and cysts. And that's caused by P. acne, a bacteria that lives on the skin that causes inflammation. And you could also get the clogged pores, and that's your whiteheads and blackheads. They're also called comedones. There's different medications to treat each type of acne. And so most people have both types of acne. So you usually start to see acne around puberty, and that's because our hormones trigger the clogging of the pores, and so usually around puberty is when we start to see it. But it happens in all ages, actually. One of the things that I see a lot is adult women who come in, and even adult men who feel like, oh, I'm not a teenager, I don't know why I'm getting this, and it's a lot more common than you think. A lot of times we see it run in families. So if mom or dad had bad acne, the child might have acne. So once you start to see some whiteheads and blackheads, or even some inflammatories, those red bumps or pus bumps, you want to, take care of it as soon as you can, because that would prevent, scarring from developing. So yeah, there are certain things that you can start off with, such as over-the-counter benzoyl peroxide and salicylic acid. But if we feel like it's not going or it's not progressing and getting better, then that's a time to visit your dermatologist. So it depends. If they have that inflammatory acne, we usually start off with a topical antibiotic, and if it's severe enough, we'll go to an oral antibiotic. I don't like to keep people on oral antibiotics more than 3 to 6 months, because then you develop drug resistance. So then we look at alternative options, such as in females, more hormonal based, or in males, we talk about Accutane. In both females and males, we talk about Accutane if they fail oral antibiotics for that severe or moderate to severe cystic inflammatory acne. And it can get worse before it gets better, so you want to allow time for that. Actually, the closest thing we have to a cure is Accutane. So a big proportion of patients who go on Accutane don't have significant issues with acne anymore. A smaller percentage might have breakouts here and there, but they're well controlled by products that they were using before that are more effective after being on Accutane. So there is hope. That acne is so specific to the person. It's best to see a dermatologist to get an individualized treatment plan. It's a specific treatment plan for the patient, because it's not one size fits all. It's you're doing it targeting to the type of acne that the patient has and the severity as well. Now, I see a big difference in my patients when they come in for their initial visit, and it affects their self-esteem, their confidence, their ability to make eye contact with people. And when they're treated, it's just a whole different, it changes their confidence, their personality, they're more social, they're happy. Windsor Dermatology is the best place to go because we have the best doctors.